Well, good afternoon, and thank you for joining us for another edition of Dialogue with the Dean. I'm Eric Barker, Dean of the Purdue College of Pharmacy. It's a pleasure to have you watching this video dialogue once again. As usual, if you have questions that you would like us to address during the presentation or after the presentation, please use the comment box there on Facebook, and we'll come back at the end and address those questions. Well, today we are going to learn more about smoking cessation and smoking cessation research at Purdue University. It's a pleasure to welcome Dr. Karen Hudmon, Professor of Pharmacy Practice. Karen, welcome to the Dean's Dialogue today. It's a special day in the nation, so we're going to jump right into questions. Today is the Great American Smokeout. So tell us a little bit, for folks who have heard about it but may not know the details, what's the purpose of this national annual event?
So this national annual event actually started with a pharmacist in California, Fred Mayer. We look at him as kind of the father of public health pharmacy, and he started the very first Great American Smokeout. And so in his pharmacy, he asked patients to give up smoking for a day. Just put their pack aside and then see if they could make it go another day, then another day, then another day. And so eventually the American Cancer Society adopted this concept and took it national. And so that's what we do. We ask people to drop their cigarettes for a day and consider it as the beginning of a quit attempt. So.
As of August 1st of this year,
yes,
Indiana pharmacists can now prescribe smoking cessation medications. What are the benefits of having a pharmacist prescribe these medications? What's the opportunity for pharmacy now?
We could talk for an hour on that topic alone. Well, as you know, tobacco is the leading preventable cause of disease and death in the United States, and physicians don't have time to address it. Nurse practitioners don't have time to address it. Physician assistants don't. Those that can prescribe these meds have very little time to address tobacco cessation in their practice. So we think that spreading the burden of treating tobacco use and dependence to pharmacy and other disciplines really broadens access. And so if you think about it, if you were a tobacco user and you wanted to quit and you wanted to use Chantix, for example, prescription only, right? So you would have to get an appointment with your prescriber, which on average, I think the average is now 28 days or so, if you can, right? And so within 28 days, what can happen? Who knows? You forget about it, right? And so the benefit, there are a lot of benefits, but I think the main benefit is that patients can have nearly immediate access to someone who can provide them that medication, not just dispense it, but write the prescription, help them to kind of navigate all the different options for tobacco cessation right there in the pharmacy. And so we had legislation that passed in the state of Indiana, was signed by Governor Holcomb over 2 years ago. We were there, you and I were both there, right behind him as he signed it. And then it took 2 years to get what we call a standing order for the state of Indiana. And that basically provides the pharmacist the ability to write the prescription under the state health commissioner's name, who is now Dr. Chris Fox. And so this order has pharmacists, patients can come to a pharmacist who has had training. They have to have had some form of tobacco cessation training, some type of CE program. And then they can work with the pharmacist to help select a medication, write the prescription for the medication, dispense the medication, and counsel. So there's 2 parts to smoking and there's 2 parts to quitting. So there's the behavioral piece and there's the addiction to nicotine. So the medicines help make patients more comfortable while they're quitting. And so that takes care of that, but then there's also the behaviors. The pharmacist can either choose to provide the counseling to the patient there in the pharmacy or refer the patient to the tobacco quit line, so 1-800-QUIT-NOW, which is highly effective in the state of Indiana. And it's free. It's provided free. And so the pharmacist then basically gets them started, and then within 14 days they're required to have a follow-up with the patient. It can be done by phone, it can be done in person, but regardless it has to happen to make sure the patient's doing well and that they don't need to tweak their regimen. And so that's part of the protocol, and then at the very end of their medication regimen they get a phone call to make sure that they're terminating the meds and moving forward and hopefully still off of tobacco. And so what I just described is far more than any patient will ever get in a doctor's office. So increased access, better intervention, and bottom line is we do a much better job of training our students in pharmacy nationally compared to schools of medicine.
Sure.
IU School of Medicine, less than 1 hour.
Wow.
Purdue College of Pharmacy, 8 to 9 hours of tobacco education.
Tremendous opportunity for pharmacists to really impact a major public health need in our country.
Yes.
Yeah. Well, you have a grant from the National Cancer Institute. tell us a little bit about what that grant's going to do and how it will
Right.
help to move the profession of pharmacy forward as a key provider of tobacco cessation services for patients.
Right. So this is a new grant. It was funded in September from the National Cancer Institute, and it's a cancer education grant. So it's not a hardcore research grant. So it's kind of a little different for me. But what that does is, it's one thing to have legislation. It's one thing to have a standing order where pharmacists have the ability to do this. But actually helping them to do it, to reach that level, kind of to practice at the top of their license with respect to tobacco cessation is an entirely different task. So this grant will train pharmacists, pharmacy technicians, which we know are really important in this process, and they embrace it too. Ask about tobacco use at the point of intake of a prescription, advise patients to quit, they're allowed to do that, and then refer those patients to the pharmacist for more counseling if they're ready to quit and they want a med, and or refer them to the tobacco quit line. And we know they can be effective in this role because we studied this in a 2-state randomized trial. And so we're going to train pharmacists, pharmacy technicians, then we'll be working with the colleges of pharmacy with the experiential folks to train up preceptors, so preceptor development. And we'll be offering live trainings, 3-hour trainings for pharmacists, and then also more in-depth, kind of people who want to move beyond the basics. We'll be doing live 8-hour trainings, and also for preceptors. And then for the technicians, we'll be doing web-based trainings. And so everything we offer will be live and web-based for the pharmacists, and then just web-based for technicians. And so we're working with the State Health Department. We're working with all of our key partners, Indiana Pharmacy Association. Actually, I just got off the phone with the CDC. They are really interested in moving pharmacy forward with this aspect, and so we had a partner call this morning, so very exciting, really exciting. I feel like we've been waiting for this for 20 years, and here we are. So, and this grant will really take it to the next level, and I think without it, it probably wouldn't happen. So.
Well, thank you for your efforts. This is really exciting. It's going to be
you can tell I'm excited too.
I can, and we're excited to see where this is going to go in the next 2 or 3 years. But then as we really see pharmacists' role in tobacco cessation and really getting major traction across the country, the impact it's going to have on the health of the nation.
Yeah, and the access. It's really all about access to evidence-based treatments and people who have the skills to help. Yeah.
You probably have a question for me.
Oh, I always do.
Yeah.
I do have one, and this is something I've struggled with personally since I came to Purdue, but we don't have a tobacco-free campus. We have areas where smokers can smoke, but I'm wondering what it would take and when you think it might happen that we will eventually go tobacco-free. For example, our Fort Wayne campus is tobacco-free. IU, a lot of Big Ten schools are, but we aren't, and I don't understand that.
I think the biggest thing we could do as a college is be leaders on our campus to sort of begin to get the grassroots movement that says this is important, here is why it's important, and that the administration and the Board of Trustees can see that this isn't necessarily a top-down drive, but it's actually from our faculty, staff, and students. So I would encourage us, and maybe you and I can have a dialogue about this offline, that it's time, and maybe now is the time, that we begin to put together sort of the coalition internally between pharmacy, nursing. Many of our colleagues in the College of Health and Human Sciences care deeply about public health issues. We have a new Department of Public Health on our campus that has now been formed, and so I think the time is right for us to bring the right players together and to get student organizations behind this as well, and put together a proposal and really have a dialogue. It's, the Surgeon General was here on Monday of this week, and he talked about syringe services programs, and he had to go into some counties in rural Indiana and begin to bring people along. And I think that's exactly the model that we should be thinking about, is how do we bring people along. Sometimes we might be surprised there's less resistance than what we think, but I think in our culture today, we recognize the public health issue of smoking and
the
tobacco
cost to
products.
healthcare
Absolutely.
too.
And so I think the dialogue is right. So I hope that we can work together. Let's think about who the right individuals are to get the right student groups and to begin to have dialogues at the college level, so that 2 or 3 colleges could then come together with faculty, staff, and students and put something forward and see if we cannot get traction on this. I don't think that there's necessary strong resistance from the administration, but as is the case, there are folks that feel very passionately about their ability to smoke, but we also understand the public health consequences and the costs that it has. But the most important thing is we just want people to live healthy lives.
That's right. And I think if this were to happen, we need to do it in a way that's supportive of those folks to get them to that point.
Yep.
You know, make sure that all the meds are covered, which we've done a good job with HR. We've worked with them, but also to make sure they have ready access to all different types of help to become tobacco free.
Well, I look forward to having this conversation
I do too.
more with you, and let's think about how we're going to take this forward and really be leaders on our campus in this space. And I think that's what this College of Pharmacy ought to be doing.
Sounds great.
Well,
thank you, Dean Barker.
Well, thanks for being with me, as always. Please comment on the video, share the video so that others can hear what's going on. Today, November 21st, right? Today, Thursday, November 21st, is the Great American Smokeout. If you're going to say, don't want you to do things, if you're going to tell smokers out there or who have family members who are smoking, they could still quit for the rest of today.
Oh yeah, absolutely.
So what would you tell them about the Great American Smokeout?
I would say there's never a better time to quit smoking than today, but make sure you have a plan. Use medications to make you more comfortable while you're quitting, and get professional help. Call the quit line at a minimum, 1-800-QUIT-NOW, and talk to your pharmacist.
That's 1-800-QUIT-NOW.
Yes.
And that'll be a great way for us to end the video today. So thanks for being with us. Again, make some comments. As always, thanks for joining us. We'll look forward to seeing you next month. We wish you all a very happy Thanksgiving, and we'll see you next month. Hail Purdue and boiler up.
Right up.